Hello everyone, this is Dr. Ghazal Matloob Baloch, and today this is my first session regarding the exam PLAB 2. I am going to give an orientation to the PLAB 2, its the exam, its stations and its structure, and in the second part I will be talking about the detailed structure of the history, that how to take a standard history to achieve full marks in the data gathering. So, from starting the introduction of the PLAB 2, I think I should introduce myself before that. I have passed my exam recently in 2022 and I failed only one station in my exam out of the 16 stations, and it was because that I understood the structure completely and I knew that how I have to prepare smartly rather than doing everything thoroughly. So always the orientation to the PLAB 2 is really important before you start preparation for your exam. You should know that how many marks each station contains and how many minutes you have to perform and which category contains the maximum number of stations in the exam. When you enter into the exam, you will have total 18 stations, out of which you will be performing or you will be talking to a patient in the 16 stations, and there will be 2 stations where you will be only resting, and those are the rest stations. You will have rest stations of 8 minutes. Each station of rest is for the 8 minutes, and all those 16 stations are all also for the 8 minutes. So in those 8 minutes you have to perform, you have to take a focused and relevant history, you have to do an examination, you have to order the labs, and you have to make a diagnosis, and then you have to narrate the management. And during those whole 8 minutes while you are doing these things, you also have to address all the patients concerned in that station. Now, all those 16 stations will not be where you will be talking to the patient completely. There are 3 to 4 categories in which these stations are divided. There will be few stations where you will be taking a detailed history of the patient and then telling the management. There will be few stations where you will be only breaking a bad news or a bad diagnosis to the patient or the patient's relative, and you will be dealing that situation. There will be few stations where you will be only performing a procedure or an examination, and there will be few stations where you will be teaching to someone like a nurse or to an FI1 doctor. And there will be a few combined stations where you have to actually perform, you do the examination and take the history and do the management as well. So I have written the breakdown of those 16 stations is like this. You will always have one station from the teaching category. You have to teach to someone like a nurse to or FI1 doctor. Secondly, there is always one station that is combined where you actually perform the examination with the history and the management. And there is always one station where you have to do a clinical procedure. I will be talking in details what kind of procedures, what kind of examinations, or what kind of teaching stations come in the exam. Just right now you have to see the breakdown. And then after the procedure, there is one station that is always from the Siemens. Siemens are those dummies that will be lying in the cubicle, and you have to deal with one emergency. This patient will be in a collapse state, sometimes conscious, sometimes unconscious, and you have to act accordingly and save the patient. There is a fifth station that is always, there will be always one station from the prescription. There are a few times or rare times you can say when there are 2 stations from the prescription where you are not talking to the patient. This station will be without the patient, without the examiner. You just have to write a prescription on an NHS prescription form. And then there will be 2 stations, or sometimes there are 3 stations from the ethics part, and then there are 2 or 3 stations that come from the counseling part, and there are sometimes 1 or sometimes 2. More likely 2 stations will be there from medicine part. And then collectively, sometimes ENT, sometimes from derma, sometimes from eye or psychiatry, there will be one station there. And then from the surgery, urology and gynae, collectively there are one or two stations there. And there is always one station that is mandatory from the peds. So if we see this breakdown, that means the teaching, the first five, teaching, examine, combined station, procedures, semen, prescription, these are the ones that you really have to pay attention. You have to focus, because these five stations are always confirmed that there is always, these five stations are always going to be there. So prepare accordingly. And then after that, ethics and counseling have got the major part. So you really need to emphasize your preparation on ethics and counseling really well. Now if we talk each category number wise and and I am going to tell you the details of every category. So as I told you, there is always one station from the procedure. So these are the procedures that are coming nowadays in the exam. After the COVID, the procedures, number of procedures have been reduced, and only these five procedures oftenly coming the exams. Number one, sometimes there could be a procedure with the urinary retention, and you have to pass the Foley's catheter to the patient. Secondly, the second, third, fourth, and fifth, these are the stations where you will be doing pricking a needle and taking the samples. It could be either passing an IV cannula for the sake of giving IV drugs. It could be taking samples in 3 vials to check the paracetamol toxicity levels in the body of the patient who have took more than 20 or 25 tablets of paracetamol. Or sometimes there is a patient with a chest infection or something else, and he is in the hospital, and you have to draw samples for aerobic and anaerobic blood cultures. And number 5, there would be a patient where you have to do ABGs of that patient. So these 5 procedures you should be prepared in your exam. And out of apart from these, all the procedures you can skip that used to come in the old days. Then, if we talk about the examination, there is always one station in the PLAB 2 from the examination, one examination station, and rather than coming only examination station, this comes as an, you can say, a combined station, where you will take the short history of like 2 minutes, then do the examination, and then talk to the patient and tell your findings to the examiner or manage the patient. So these are the 6 examination stations that come in the exam. Number 1 is the abdominal station, abdominal examination. This scenario come in under 2 categories. Sometimes it is alcoholic related liver disease that is complicated now and developed an ascites in the patient, or it could be an ovarian carcinoma in old lady and there is ascites. Secondly, there will be a pregnant lady and she will be there for her antenatal checkup. It could be like high BP, and it's a very high yield station that comes oftenly in the exam. It is an antenatal examination and it's very easy. Number 3, there is a patient who can present with some kind of a mass or swelling in the testes, and you have to do an inguinoscrotal examination. Number 4, there could be a patient with a back pain or any urinary symptoms that are related to the BPH, benign prostatic hypertrophy or prostate cancer, and you have to perform a digital rectal examination. Number 5, there will be a lady who will be there for her pap smear that is done in the females, and you take a cervical sample, and that is called pap smear, to check the health of the cervix, to see the if everything is right there is no changes in the epithelium, and that is called the vaginal speculum examination. Number 6, there will be an ENT station where you will be doing an air examination on a dummy, and that is called otoscopy. And then I was talking about the Simmons, and that is a dummy that will be lying down in the cubicle rather than the actual human. And these are the 7. These 7 scenarios are the very common one that comes in the exam. But apart from these, there are many other scenarios that could come. But these are the 7 that you should be actually prepared for. So there could be a semen lying with acute exacerbation of asthma or COPD. It could be a patient who will be there with the severe pain in the leg, and there will be swelling or pulselessness and paleness of the leg, and that would be the case of acute limb ischemia. And number 3, there would be a patient who will be drowsy or unconscious, or she will be fainting, and she was there post delivery, and she is on examination, you will find there is a lot of bleeding, so you have to manage according to the guidelines of postpartum hemorrhage. There could be a patient who will present with upper GI bleed as a result of the peptic ulcer disease. Then number 5, there will be a patient who will be in a confused state and will not be answering all the questions to you in an appropriate manner, and that is sepsis or septic shock. And the reason behind that would be sometimes chest infection and sometimes UTI. And then number 6, it could be the case of atrial fibrillation, and you will find abnormality on the monitor, cardiac monitor, that you will see that irregular rhythm, and you will know that it's atrial fibrillation. Number 7, it will be an unconscious patient. In hypoglycemia, it will always be an unconscious patient, and when you will be doing a thorough examination of that semen on BSR, you will find a very low BSR, and that will be the case of hypoglycemia. These 7 scenarios you should always be prepared for. Then, talking about the teaching stations, these 6 teaching stations are the most high yield that come in the exam, and I haven't seen any change apart from these stations in the past few months. And you will be teaching sometimes a nurse, and sometimes a fellow colleague, and sometimes an FY1 doctor. And you have to teach sometimes an ECG, sometimes teach the student to how to do an inguinal examination, and with that you may need to teach hernia and anatomy of the inguinal canal. And then number 3, there could be a scenario where mother will be there whose child had anaphylaxis and child is in hospital. Now you have to tell the mother that how to use an EpiPen if the patient have again the same episode in the home, in the house. And number 4, it will be a basic life support, BLS. You will teach your junior that how to do the BLS. And number 5, there will be a junior or nurse. You will teach that how to do a urine dipstick test and how to interpret the results in the kit. And number 6, again the speculum examination. That is also an examination station. I told you that speculum is speculum and inguinal. Actually, these two sometimes come under the examination and sometimes come as a teaching stations. Okay, now after that, there are some do's and don'ts for the exam. Before you start the prep for the PLAB 2, you should be aware from them. Number 1, always keep smiling when you enter into the cubicle, unless it's the bad news station. Doctors do not enter into the cubicle with a very serious face, because you have to build a rapport with your patient. And once you just think it like that, even if you're passing by a street and you give a smile to a stranger in the street, he or she will give you the smile back. Most oftenly in the scenarios, they will give you a smile back. So that is kind of a non-verbal cue. It was kind of a friendly gesture. So when you enter into the cubicle, you tell your name and your GMC number to the examiner. Please keep smiling, because you are building a rapport there. Then when you will introduce yourself to the patient, again, please build a rapport by giving a good smile. Not laughing, just giving a good smile. Even though you're wearing a mask, a patient can tell that either you are having a very serious face, you are anxious, or you are calm and having a friendly smile. Then number 2, please, when you talk to the patient, keep changing your tone so that you don't sound monotonous. Sometimes use a high pitch, sometimes use a low pitch, sometimes keep it fast if you want to save time, sometimes keep it slow, because if the patient is worried at any point, just keep your tone slow or pace slow, so that a patient don't think that you're just you're just running fast, because you are running out of time and you're not paying much attention to the patient's concern. Then please maintain your body posture when you enter into the cubicle. When you sit on the chair, there is a decent distance between the doctor and the patient, but many doctors, they keep leaning back on the chair like they don't care and they're chilling out. It kind of looks rude. Or sometimes they lean so much forward, it's something, it's sometimes kind of it seems like that you're anxious and you're not maintaining your body posture. And please do not cross your legs. these are the tips to maintain your body posture. And please do not overuse your hands while talking. And then please keep an this is a key to pass the exam. If you do an active listening, number 4, if you do an active listening and you are trying to listen and you are trying to address each and every concern raised by a patient and trying to collect every information that patient told you rather than asking the same question twice because you are not listening before, you will pass your exam, because active listening gives you a direction to make a diagnosis. And then number 5, please address any concern that is raised by the patient then and there. Sometimes doctor, what they do is they keep postponing the concerns. They say, yeah, okay, we will talk about that in the last. Just let me complete my questions. Just let me complete my questions. This kind of gives a very bad, you're building very bad rapport with the patient, because you never know that you will have time in the last, because you have only 8 minutes. If you're not answering those concerns right then and there is a great chance that you will miss those concerns. So don't postpone those concerns, just answer them quickly then and there. And then please do not use the same sentences on repeat. And those 8 minutes, make sure that every time you offered an empathy or support, always use different kind of vocabulary, and that you can write down in your register, and then like 11 to 12 pretty decent sentences, and then you can repeat those 11 to 12 sentences in those 8 minutes rather than using the same sentence again and again. And then please do not be defensive if you make any mistake. For example, when the doctors don't do an active listening, uh, patient will give you one information, doctor, I have pain in my chest, and then the doctors repeat, can you tell me where is your pain? And the patient will be kind of pretty angry. I just told you, doctor, that it's in my chest. So don't be okay, okay, I was busy or I couldn't hear. Just don't say okay, oh my bad, I'm really sorry, I will try to be more active in our conversation now. Just don't defend, and just offer a sorry. And if it's a station where you have made a medical error, sometimes there are stations where you will be talking to the patients to whom you have made a mistake, like interpreting the x-ray wrong and something like that. But just don't be defensive, just accept and offer an apology to the patient. And then is the understand the task and act accordingly. Before entering into the station where you will have 8 minutes, you will read the scenario outside the cubicle, and you will have 90 seconds to prepare yourself after reading the scenario. So this is the golden time where you need to at least read the scenario 3 times and then understand the task, that what kind of station it is. I have seen doctors who enter into an examination station, and they will keep taking history and doing the management, and they will not move from their chair and do the examination. So automatically you will fail the station, because you didn't understood that you had to perform an examination in that station. Sometimes a station will be like this, address the patient's concerns, and rather than, and after entering into the station and addressing the concerns of the patient, they will keep taking a prolonged 6-minute history. So you will fail the station, because the task was not to take a detailed focused history, it was to address the patient's concern. So please perform accordingly what has been given into the scenario. And then always take consent for everything. If it's a station where you are doing a procedure or examination, or it's a cement station where you will be doing a thorough assessment, before touching the patient, just tell the patient what you are going to do, and you will be having a chaperone with you, and then you need a consent. And if the patient says it's okay with me, and then move forward, and then go ahead for the for touching the patient. But just don't touch the patient before you take a consent, because it's unethical. And then please try to pick non-verbal cues. What are non-verbal cues? For example, if you enter the station and you have seen a patient who is looking on the floor, and she is not making an eye contact, and she looks sad or gloomy, it could be a patient who is having depression or going through a domestic violence maybe. or sex trafficking, maybe something like this, and you have to pick your cue. The patient is not going to automatically spill out everything. You have to make an effort. You will say, I can see, Mrs. XYZ, that you look gloomy, or you look anxious, or you look sad. Is there something that is bothering you? Is there something that is going on in your mind? It's a safe space. Can you please share that with me? So try to pick nonverbal cues. And then number 12, please do not assume everything. uh, if you have any kind of query in your mind, just don't assume that that would be the scenario in this patient's life. Just ask that question and do not go with the assumptions. Sometimes, for example, I will give you an example. A patient will be there who want to do an abortion, right? So she want to do an abortion, and you have just assumed that patient is married and the patient is not having good relations with the husband. So you start, okay, how's your relationship with your husband? The patient will come out like this: I'm not married, doctor. So you have assumed something, and it's kind of an embarrassing situation. Sometimes that pregnancy could be from, it could be from a boyfriend. So uh, you have to ask that before, and you can say, who is the father? May I know that? And uh, what is your relation with the father of this child? So you should know, either it's an ex-husband, it's an husband, or it's in some kind of other thing like boyfriend, or something like that. So please do not try to assume things, and ask those questions directly. And in the end, this is the line that I keep telling everyone: that key to pass the exam is when you focus on managing the patient's concern rather than managing the patient. Now, I told you that when patient raises a concern, just answer that concern then and there, rather than uh, waiting for the end, and then address all those concerns, because you won't have time. And if you haven't addressed the patient's concern but you told all the management, you will still not pass the exam, because your priority was not the patient's concern. So try to focus on managing the patient's concern. With that, I will finish my orientation to the PLAB 2. Doctors, I will be uploading a second part, which will be about how to take an ideal history and the structure of the history, and how to achieve full marks into the data gathering. Please let me know in the comments that was this session was useful for you. Did you understood the structure of the exam? And if you have any questions, please leave in the comment box and I will tell you. And if you have liked the video, please like, subscribe, and share my channel with everyone. Thank you so much.